As men grow older, they may begin to worry about any number of health problems. Heart attack, prostate disease, colon cancer. These are just some of the illnesses that men are often concerned about. But one condition that men generally don't worry about is osteoporosis. Most people think of this as a disease that affects women after menopause. While it's true that osteoporosis is more common in women, it's also true that fully 20% of the 10 million Americans who suffer from osteoporosis are men. This means that 2 million men in this country have osteoporosis, and most don't know about it. This video will help men understand what osteoporosis is, what the signs and symptoms are, how they can help prevent the disease, and what can be done to treat it once it does occur. First, what is osteoporosis? The simplest answer is that osteoporosis is a thinning of the bones. To explain it further, osteoporosis is a progressive loss of bone mass that results from an imbalance in the buildup of new bone and the breakdown of old bone.
Bone, like every other living tissue in the body, is in a constant state of turnover and renewal. This surprises many people. We know that our hair and our nails grow, that our skin sloughs off, but we think of bone as constant and unchanging. In fact, about 10% of bone mass turns over every year. That means that every 10 years, the body completely renews the skeleton.
As we age, these continual states of bone growth and breakdown may be thrown out of balance. When more bone is broken down than is built up, bones become thinner and weaker.
It's interesting to think about building construction. When you stop and think about it, a building is put together with bricks, mortar, supporting struts. Unfortunately, over time, weather can take its toll on the mortar. It can eat the mortar away. Termites can eat away at the supporting struts, and when that happens, the structural integrity of the building is compromised. It's weakened, it's more likely to collapse. And unfortunately, exactly the same process can go on in osteoporotic bone.
A number of factors increase a man's chances of developing osteoporosis. Some of these are outside of a man's controls, but others depend upon lifestyle. First, low testosterone levels, either naturally or as a result of certain drugs such as those used to treat prostate cancer, increase the risk of osteoporosis. Corticosteroids, for example cortisone or prednisone, which may be prescribed for arthritis, skin disease, or other conditions, can cause bone loss when taken in large doses and over long periods of time. Genetics may also play a role in osteoporosis. Researchers are studying genes that control bone mass to determine how these affect a person's chances of developing the disease. African American men often have stronger and larger bones, and so are somewhat protected from osteoporosis. In contrast, Caucasian men are at significant risk, and this risk goes up as a man ages. There is not as much information concerning Asian and Hispanic men, but they may suffer somewhat fewer fractures than Caucasians. When we're younger, our bodies readily absorb calcium from the foods we eat. As we get older, our bodies may lose this ability. In addition, older people may spend very little time outdoors, but the body needs sunlight to make vitamin D, which plays an important role in bone function. When calcium and vitamin D are missing, bones are at risk. Smoking and drinking, which can damage many of the body's organs, are also known to interfere with bone tissue. Many famous men have suffered from osteoporosis, including John F. Kennedy, Winston Churchill, and Ronald Reagan. But because osteoporosis is thought to be a woman's disease, many men are surprised to learn that they have the condition.
I was shocked when my doctor told me that I had osteoporosis. My wife has been worried about this disease, but as a man, I didn't think that I would get it. I was also surprised that I had no symptoms.
So what signs should men be looking for that might indicate they have osteoporosis? Early in the disease, people with osteoporosis generally have no symptoms. As the disease progresses, people may experience back pain, especially in the lower back, and other bone pain. Another sign of osteoporosis is a loss of height over time.
Osteoporosis can affect the bones in our back, leading to loss of height. The bones become weakened, the internal scaffolding is eroded, and the bones actually compress. That sort of compression fracture can lead to loss of height. It can also lead to a stooped posture. So either of those two findings, either loss of height or a stooping of the posture, really can be very early signs of osteoporosis.
While one or more of these symptoms may occur, often the first sign of osteoporosis is a broken bone. The most commonly affected bones are the hips, lower vertebrae, and wrists.
The consequences of osteoporosis can be very serious. We particularly worry about hip fracture. Hip fracture can be very debilitating, and patients can require major surgery to replace the joint. It's important that men understand that they're at risk. About 1/3 of all hip fractures in the U.S. occur in men. Furthermore, men are at about twice the risk of dying after a hip fracture compared to women.
Once bone is lost, it is very hard to rebuild it, so preventing bone loss in the first place is very important. Men can help maintain bone mass in several ways. First, it is important to obtain enough calcium and vitamin D. Dairy products, or if necessary, vitamin supplements, can help maintain a healthy level of these nutrients. Regular exercise is another important step for preventing osteoporosis. Weight-bearing exercise appears to be the most effective in strengthening bones, but many kinds of exercise may help prevent fractures by maintaining leg strength and coordination, thus helping to prevent falls and fractures.
Weight-bearing exercise helps protect bones in two ways. First, it directly stimulates bone and makes them stronger. Second, exercise strengthens the muscles that support the bones. This provides another means of protection against fracture.
To be effective, exercise must be performed regularly, about 3 times a week for at least 30 minutes. It's also important to adhere to proper exercise technique and to build the level of exercise slowly. Putting too much stress on bones too quickly or using improper technique can damage rather than protect your body. If osteoporosis does develop, early detection and treatment can help prevent serious complications.
Beginning around age 70, it actually makes sense to have a physical exam that includes screening for osteoporosis. That physical exam really should include a height measurement as well. You may want to talk to your doctor about risk factors for osteoporosis that you may have, but you definitely want to think about having a height measurement. If you're already losing a significant amount of height, that may be an early sign that you're starting to develop osteoporosis.
Several tests may be used to diagnose osteoporosis. The most common is a test called DXA, or Dual Energy X-ray Absorptiometry. This is a special type of X-ray that evaluates bone mineralization.
The DEXA scan is very important because it can not only show that a man has osteoporosis, but it can also show if he has low bone mass. Low bone mass may result from lesser bone formation early in life, or can be a kind of pre-osteoporosis. In any case, it may indicate that this person is at greater risk of developing osteoporosis later on. At the very least, any man who has had a fracture after the age of 50, or who has a risk factor for osteoporosis, should have a DEXA.
Another test that is often used to diagnose osteoporosis is a standard X-ray of the spine. This will show if any of the vertebrae are fractured or collapsed, which is another strong indication of osteoporosis. Finally, your doctor may order blood or urine tests to rule out other diseases that might cause similar symptoms. Once a diagnosis of osteoporosis has been made, treatment is aimed at slowing or halting loss of bone, preventing fractures, and controlling pain caused by the disease. First, men with osteoporosis can take steps to help protect themselves and avoid broken bones. Many of these are common sense. For example, men should reduce their risk of falling by keeping floors clean, making sure that rooms are well lit, and use handrails on stairs and in the bathtub. They should also take steps to protect their bones by learning good posture and avoiding strenuous physical activity, such as heavy lifting, that might put unnecessary stress on thinning bones. Another option to treat osteoporosis is drug therapy. The newest drug treatments can actually rebuild bone and increase bone mass, sometimes dramatically. These drugs can also help repair bone architecture.
Today, fortunately, we have drugs, medications, that can strengthen bone and decrease the likelihood of having broken bones, fractures. That just makes it that much more important to diagnose osteoporosis early before significant bone damage has occurred.
What does all of this mean for men? First, that osteoporosis is not just a woman's disease, that men are also at risk. And when men do develop the disease, the complications can be very serious. Second, men can take several basic steps to help reduce their risk of developing osteoporosis, including getting enough calcium and vitamin D, and performing regular, weight-bearing exercise. And finally, new technology and drugs are available that can diagnose osteoporosis earlier and treat the disease more effectively than ever before. So talk to your doctor about osteoporosis, because, as with so many diseases, early intervention and treatment can greatly improve your chances of keeping your bones strong for a lifetime.